Hello, everyone. Today we will learn about the talocrural joint, that is, the ankle joint. 1. The talocrural joint is also called the ankle joint. It is composed of the lower ends of the tibia, fibula, and the trochlea of the talus. It is an approximately uniaxial hinged joint. When the foot is in dorsiflexion or plantar flexion, its axis of rotation is variable. The joint capsule of the ankle joint attaches around each articular surface. The anterior and posterior walls of the capsule are thin and lax. The ligaments on both sides are thickened to reinforce the joint. There is a medial ligament on the medial side, also called the triangular ligament. It is a tough triangular fibrous cord. It originates from the apex of the medial malleolus. It spreads out in a fan shape downward. It inserts into the navicular bone, talus, and calcaneus. The lateral ligament consists of 3 separate, independent ligaments. The anterior one is the anterior talofibular ligament. The middle one is the calcaneofibular ligament. The posterior one is the posterior talofibular ligament. All 3 ligaments originate from the lateral malleolus. They extend anteriorly, inferiorly, and posteromedially respectively. They insert into the talus and calcaneus. They are all relatively weak. The ankle joint can perform dorsiflexion, extension, and plantar flexion movements. The trochlea of the talus is wider anteriorly and narrower posteriorly during dorsiflexion. The wider anterior part of the trochlea fits into the articular fossa. The ankle joint is relatively stable during plantar flexion. As the narrower posterior part of the trochlea enters the articular fossa, the foot can perform slight lateral movement. The joint is not stable enough. Therefore, ankle sprains often occur during plantar flexion, such as going downhill, descending slopes, or climbing downstairs. 2. The intertarsal joints are the joints between the various tarsal bones. Among them, the talocalcaneal joint, also called the subtalar joint, talocalcaneonavicular joint, and calcaneocuboid joint are relatively important. The talocalcaneal joint and talocalcaneonavicular joint are coupled joints in function. During movement, the calcaneus and navicular bone, together with the remaining tarsal bone, perform inversion or eversion movements relative to the talus. When the medial edge of the foot is lifted and the sole faces medially, it is called inversion. When the lateral edge of the foot is lifted and the sole faces laterally, it is called eversion. Inversion and eversion often coordinate with ankle joint movements. That is, inversion is often accompanied by plantar flexion of the foot. Eversion is often accompanied by dorsiflexion of the foot. The calcaneocuboid joint and talocalcaneonavicular joint together form the transverse tarsal joint. It is also called the Chopard joint. Its joint line crosses the middle part of the tarsals. It presents a horizontal S shape. The medial part protrudes anteriorly. The lateral part protrudes posteriorly. In fact, the joint cavities of these 2 joints do not communicate with each other. They are 2 independent joints anatomically. Clinically, foot amputation can often be performed along this line. Between the various tarsal bones, they are also connected by many strong ligaments. The main ligaments include the plantar calcaneonavicular ligament, also called the jumping ligament. It is a wide and thick fibrous band. It is located on the sole of the foot. It connects the calcaneus and navicular bone. It plays an important role in maintaining the medial longitudinal arch of the foot. The other one is the bifurcation ligament. It is a strong Y-shaped ligament. It originates from the anterior dorsal surface of the calcaneus. It divides into 2 branches anteriorly. They insert into the navicular bone and cuboid bone respectively. There are also some other ligaments on the sole of the foot. They connect the calcaneus, cuboid bone, and the bases of the metatarsals. All of them are of great significance for maintaining the arch of the foot. 3. The tarsal-metatarsal joints are also called the Lisfranc joints. They are composed of the anterior ends of the 3 cuneiform bones and cuboid bone, and the bases of the 5 metatarsal bones. They belong to plane joints. They can perform slight gliding movements between the medial cuneiform bone and the first metatarsal bone. Slight flexion and extension movements may occur. 4. The intermetatarsal joints are located between the adjacent surfaces of the bases of the 2nd to 5th metatarsal bone. They belong to plane joints. They have very little mobility. However, the bases of the 1st and 2nd metatarsal bones are not connected. In this aspect, the great toe is similar to the thumb. 5. The metatarsophalangeal joints are composed of the heads of the metatarsals and the bases of the proximal phalanges. They can perform slight flexion, extension, adduction, and abduction movements. 6. The interphalangeal joints of the toes are composed of the bases of the two adjacent phalanges of each toe and the trochlei. They can perform flexion and extension movements. There are some other ligaments on the sole of the foot. They connect the calcaneus, cuboid bone, and the bases of the phalanges. All of them are of great significance for maintaining the arch of the foot. Well, through the above learning, we have learned about the connections of the lower limb. Next, we will start learning about muscles. Thank you.